This is how I like to think about kidney stones. I'll break it up usually into risk factors, size cutoffs, as well as watching out for the dreaded sequela. Risk factors for kidney stones include family history, dehydration, increased salt intake. 1 in 6 Americans will develop stones, and 50% of people, once they get a stone, will develop another stone in 5 years. So, actually, most people will have a story with stones. When you think about stones, you want to think about different size cutoffs. So you want to think less than 5 millimeters, 5 millimeters to 2 centimeters, and greater than 2 centimeters. A lot of this has to do with the size of the urinary tract. So stones mostly get stuck in places of narrowing inside of the urinary tract. It goes from kidneys to ureters to the bladder to the urethra. So between the kidneys and the ureters at the uretero-pelvic junction, you're going to have a lot of stones. That area, the ureters are about 4 millimeters wide. As you go down the ureters, they become roughly 3 millimeters wide. And right between the ureters and the bladder, that's called the UVJ, or ureterovesicular junction, and stones get stuck there. The last place is near the bladder and the urethra. Stones get stuck there, but the opening there is 10 millimeters wide. So less than 5 millimeters, stones will pass about 50% of the time on average in 3 weeks. This means stones can pass instantaneously, but can also take like 6 weeks long too. If stones take that long, then chances are they're not going to pass. Between 5 millimeters and 2 centimeters, this is when you want to do things like ESWL, extracorporeal shockwave lithotripsy, as well as ureteroscopy, where you go in with a camera, find the stone, and blast it with a laser. When it's greater than 2 centimeters, that's when you want to go in and do PCNL, or percutaneous nephrolithotomy, where IR goes in, marks the spot where the stone is, and then urology can go in and poke a hole between the skin and the kidney to remove the stone. Stones are a place of obstruction. This obstruction causes the pain. The stretching of the ureters. Once the stone is further down and there's no more ureteral stretching, then you don't have the pain. Tamsulosin is something that's been well studied, but there's not too much literature support for its use in stones less than 5 millimeters. However, because it's relatively benign drugs, we oftentimes use tamsulosin in the emergency room setting for individuals with stones, but it hasn't been shown to help pass the stone. As the fluid backs up, you get stasis of the fluid, bacteria can start to grow, and if it goes into the bloodstream, then you have bacteremia, leading to sepsis, leading to septic shock. That's why for stones, you want to look for red flag symptoms such as back pain, flank pain, fevers, chills, nausea, vomiting, which could clue you in that something systemic is happening. And that's how I like to think about stones.